Lower back pain is just like any other pain. If you spend a lot of time in a seated position, the muscles that are short are going to get more tight, and the muscles that are in an elongated position are going to get more tired and more uncomfortable. So let me show you a cool, quick exercise you can do every day as you're sitting down to work at your desk for the day. Imagine your pelvis is a bowl filled with water, and go ahead and sit up toward the front of your chair. Now you'll find that your default position, you may tilt back and spill the water out the back of the bowl, or if you roll forward up on your sits bones, you'll feel the water spill out the front. Go ahead and experiment with these different positions and find out which one feels the most balanced, or like there's no water spilling. That's a little trick you can do every day when you're present in your body. All right, now let's get to the massage gun tutorial. Today we're doing the lower back and hips. Like the previous massage gun and Theracane videos, these areas and maneuvers can all be broken down into 4 categories. Those categories are the front, the outside, the inside, and the back of whatever area we're working.
Follow along and experiment with different places that are indicated on the anatomy picture on the right side of the screen. Take a round resistance band and wrap it around your ankles. I highly recommend doing this exercise on laundry day so you can join me in wearing holey shorts. Lie on your stomach on a workout bench, the floor, or your couch. For massaging the right hip, move your left foot away from your right foot to adjust the amount of resistance. If you're on a bench, reach your left arm out and brace on the floor to keep yourself from falling over. Once you're in position, keep your knees bent and move your right foot away from your left foot and massage the side, front, and back of your hip. This is hip rotation, and there's a ton of different hip rotators that could be tight with this movement. Notice how my pelvis also rocks back and forth a bit. This is another action of the hip flexor located on the front of your hip. Now switch hands with the massage gun, brace your right arm on the floor, move your right foot away from your left foot, and begin rotating the left hip with the percussion tool, or Theracane, on the left hip. Having a partner for this one might be really useful to either use a massage cane, their hands, the massage gun, or to assist with the resistance. Now lie on your back on a workout bench, your bed, or your couch. It's easiest to have a place to hold on to above you and a place to brace your opposite leg. Make sure you're feeling the stretch in the front of your hip while you dangle your stretching leg off the side of the surface you're lying on. Point your toes out and knee out and initiate the motion like you're going to lift your knee and cross your leg onto your other thigh. Or you can just keep your knee and toes pointed toward the ceiling and raise your leg, but keep your knee straight. Now we're going to do a similar motion, but with our leg up on the other thigh. This will shift the action muscles inward to the adductor group. With the front of the hip, gravity is our resistance. If you need more, you can have a partner gently resist the motion, but be sure they're also supporting the leg. Assist and resist. You may really need to dig at these. They're very dense tissues. Alright, now we'll do the same 2 stretches we just did on the other side. See the chart on the side of the screen for reference of where to use the massage tool. This next one, I want you to be extra careful that bending over and standing up does not bother anything in your spine. This motion affects all the way from the bottom of your feet, up the back of your leg, up your spine and neck, and over the top of your head to your forehead. Simply bend over, apply the percussion tool to your central lower back, stand up so you're almost parallel with the floor, and rotate your spine. This will pound out the layers of the side of your spine that are stuck to the layers on the back of your spine. Now just bend over and initiate the motion to stand back up again. Focus the percussion tool or Theracane on the backs of your thighs. You can also just bend and straighten your knees with a hint of lifting your torso. If you're not satisfied with the level of resistance from gravity and are a little more flexible, grab a resistance band and loop the ends together. Step on the resistance band and place the other side of it at the back of your neck. Gently activate the muscles involved in standing upright against the resistance. Do not strain, just activate. Use a massage gun or muscle hook anywhere on the chart that you see on the right that feels tight. A partner always makes this easier. Okay, now we're at the final movement in the front of the hip. Get into a lunge position and experiment with forward and backward pelvic tilt. Lean into the front leg and try your best to resist the natural tilt of the pelvis by keeping your torso upright and, even if you can, slightly leaned back. Once you're in the position, imagine you're pushing the toes of the back leg into the floor and flattening your low back. Your knee may bend a little bit too. Work the massage tool all the way down the front and outside of your thigh from your hip flexor to your knee. Now we'll do the other side. Play with that forward and backward hip tilt motion and keep your torso upright, perpendicular to the ground.
A lot of people talk about strengthening their core. You hear that everywhere you go.
I need more core strength.
But the core is much more than just your abs. That's the typical thing people will do. They'll hear, I need to strengthen my core, so they'll do a bunch of crunches. We have a wonderful network, actually, of fascia that's more than just the abs. And that wonderful network of fascia consists of the muscles that bring your legs together, the muscles in between your shin bones, and then they come up and they sit on the inside of the pelvis, inside of that bowl, and they come up the front of the spine to the diaphragm, and in the muscles in between the ribs. They even surround the fascia in a bag around your heart, and then to the front of your neck, your jaw, and the side of your temple. That's what we call the deep front line. And believe it or not, the true way to integrate that fascia is not through doing crunches all the time. Crunches may make you feel the burn in your abdominal muscles, but it's actually through breath work. So go ahead and click the link down in the description for access to my daily breath program. It's only $25 and it comes with a free lesson from my myofascial integration program. And that lesson is designed specifically to target freeing up the muscles within the core of the body so that you can ease the range of motion, improve the strength and flexibility of the core before you go and do the breath exercises to strengthen it. Okay, well that's it for today's video. Thanks for watching and continue to stay tuned. Remember to hit that subscribe button too.